Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well. Actually, depending on when you're viewing this, happy Halloween to you. So as you can see, I'm in a different part of the office here. This is our IV nutritional room, IV infusion room. Actually part of it. I can give you a little bit of a little view here. We got a TV and such and a few chairs. We have the same at both offices at Longevity Health Institute and Lewerenz Medical Center. But I thought I'd share with you some things because and be informative, and even to my current patients that are out there, because they know that we offer infusions and IV vitamins, IV nutrition, IV chelation, IV glutathione, things that we use intravenously because of the multitude of benefits. And so often I get asked, well, why? What would be the difference in taking a supplement or what have you? Well, a multitude of patients that we see, but many people out there in that, have digestive trouble and digestive issues. So often they're a malabsorber. They don't absorb their nutrients, minerals, things like this as well. Maybe that's why they're coming to see us. And so we have to find a way to correct some of their issues, whether it's an energy issue, an immune issue, an inflammatory issue, and use a means, a vector to bypass the digestion for a while till we heal the gut. So we use IV infusions. This started back years and years and years ago in the medical alternative world with Dr. Myers from out of Maryland in the, I think, late 60s, early 70s, and he formulated what's called a Myers cocktail. We use versions of this. Actually, we use a much higher doses nowadays of vitamin C in these multi-mineral vitamin bags that drip. And take often about 30 minutes to an hour. Often we use doses 15 grams to 25 grams, in cancer patients even up to 75 grams of vitamin C. But they would sit in one of these lazy boys infusion chairs and watch TV or read a book or search the web or get some work done. Sometimes converse with their other patients and about life. And they get the benefits of these wonderful nutrients directly to the tissue, to the adrenal gland, to their brain at a cellular level, and then they get the wonderful benefits. Very often patients will notice energy benefits, detoxifying benefits, mental clarity, and sometimes literally the moment they walk out of here. And other patients, it may take a few weeks to a month of therapy, one time a week or so, depending on how depleted they are and what we're treating. But the purposes of this would be because you're getting 100% of what we give you to the tissue, to the organ that we're trying to affect, to the immune system, to the genetics, etc. And you get 100%. When you take something orally, a good supplement, even medical grade supplements, you absorb, sadly, but this is the facts, you absorb about 40 to 50% of that if you have good digestive health. So when you use a nutrient infusion or an IV drip, you bypass that. I personally do IV vitamin C, Myers like cocktails once a month, just because I believe that it's got a multitude of benefits, from anti-aging to detoxifying to immune supportive to collagen enhancing for skin, and a lot of preventative things from an immune level, especially if you live a high intensity, high stress life, very busy like most of us, juggling a lot of things. We also offer at an infusion level things for cardiovascular disease and heavy metal detoxifying like chelation. We use EDTA, vitamin C, and glutathione, which is a very, very strong antioxidant that's got wonderful properties to chelate, which means to pull from the vascular system metals, plaque, calcium, and that. So it's a way of wonderfully reducing cardiovascular disease and improving somebody's overall cardiac health and preventing cardiac disease. These are all just some of the type of infusion therapies. We do ultraviolet blood irradiation, UBI, which has an immune benefit of modulating your immune system and treating infections in your blood, which is a IV therapy slash re-auto infusion therapy. So we treat viruses like cytomegalovirus and Epstein-Barr and Lyme's disease and viruses, candida, things like this, and very successfully because it's very direct and very purposeful for that individual. So I thought this would be helpful. Very simplistic. Actually, my IV nurse at both offices gets access. depending on what you're getting dripped, usually takes about 30 minutes to an hour. Chelation often takes a couple hours. And safety is very, 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 it's a very, very safe modality. Often people walk out of here, like I said, feeling the wonderful benefits. So hope this answers a few questions and some interest in this. You can always call our office for more assistance and more information on nutritional infusions or chelation or ultraviolet blood irradiation or any type of our wonderful infusions. But hopefully this is helpful. You can find a lot of this too on our website, longevityhealthinstituteinc.com. And hopefully this is informative and finds you well. This is Dr. Lewerenz. Have a wonderful evening.